my first recommendation would be to find a way to align incentives between hospitals, between providers, between patients, between outpatient providers as well. There are always ways, even within fee-for-service settings or things that might not seem to align, where you can come together. One example would be readmissions metrics. We know we presume that this model, and we know that others like CareMore, that involvement in the hospital setting leads to readmission reduction. Hospitals care about that, and they may invest more in you doing this work and in this model if you have an influence or an impact over that. So that's one way, is figuring out where do all of your incentives align, sort of using that as leverage to having the model, to creating the model in your space. The second thing I would recommend is really aligning with provider groups in the outpatient setting who have fully integrated systems of care. So the provider groups that are very invested, and often these are also provider groups who are financially at risk for the patients in some way. They tend to have the incentive to be more invested in the inpatient stay. But we like to find provider groups who are incredibly involved in what happens in the hospital and are working with us to help influence that trajectory of care. And the third thing I would say is that the trust in relationships with the patients is so incredibly important. When we're talking about patients who have been in and out of the healthcare system for many, many years, there's often a lot of distrust. And particularly with patients who have social needs or mental illness or substance use disorders, this gets really complicated. How do we build long-term relationships with patients who just fundamentally distrust healthcare? And finding people on the team who are really committed to that cause, to aligning with patients and to improving their overall experience and understanding this is a long game and this is really hard work, but having that relationship is fundamental for any improvement in health or health care or health outcomes.